Welcome to this video on acute bronchitis. Acute bronchitis, or I like to call it as post-infectious bronchitis. What is it actually clinically? It's a cough that presents lasting for more than 5 days with or without sputum, for example. Okay, these patients will have a cough which is days to a week long, for example, and it's typically post-infectious. Post-infectious meaning that it typically follows a viral or a bacterial illness. It typically follows a cold. So it's a post-infectious state. Okay, so it follows a cold, typically. And when it comes to acute bronchitis, it's acute, that's why it can be days long. What are most episodes of acute bronchitis because of? Almost all episodes of acute bronchitis are due to viruses. If there are bacteria that are involved, what are those? They're typically the atypical ones, so mycoplasma and chlamydia. How will we address the treatment of acute bronchitis? We will do symptomatic treatment where we're actually treating the infection. This is an infection, this is an inflammation of the bronchi themselves. So here you can see the trachea and here you can see the bronchi, they're inflamed and there's a virus in it because acute bronchitis is mostly caused by viral infections. What is bronchitis? Bronchitis is a virus and it refers to an infection of the lining of the bronchial tubes. When a person has bronchitis, it's very difficult for air to travel through their lungs because here you can see this is their bronchi and the infection is clogging up the bronchus. So which pathogens are involved in causing this acute bronchitis? Well, the viral pathogens that may be responsible for your acute bronchitis include pars pneumonic. So P for para-influenza virus. This is the mnemonic. A for adenovirus. I for influenza virus. R for rhinovirus. And I've also put M to remind you of mycoplasma, which is that atypical bacteria which causes that atypical pneumonia. So that's it. What would be the differential diagnosis for acute bronchitis? We would need a differential diagnosis with pneumonia because this acute bronchitis produces a cough with purulent sputum, for example, with the sputum being produced. What does pneumonia do? Pneumonia is also a productive cough over a matter of days or a week. Or weeks. So here your main differential would be with pneumonia. So I would like to do a chest x-ray to rule out pneumonia and a CRP also to indicate the inflammation that's going on in the body. So what's the difference between bronchiolitis and bronchitis? Bronchiolitis, if you just look at this lung diagram here, bronchiolitis is inflammation of these small airways, these tiny airways that are found in the lung. So that is bronchiolitis. Bronchiolitis of the bronchioles, the tiny airways, is the swelling. Bronchitis is inflammation and swelling of the main bronchi. Okay, here and here you can see the main bronchi. So what are the main clinical features that your patient with bronchitis will present with? They'll have a cough, which may be with phlegm or not. If it's with cough with phlegm, what are you thinking in your mind? You're thinking it's a bacterial infection. And they'll also have systemic signs because it is an infection. It could be a viral or a bacterial infection. So you'll think of fever, malaise, chills, and wheezing as well is common because there is an obstruction, right? You might be able to hear crepitations, and here it is acute bronchitis. It's an inflamed bronchial tube. As the bronchi and the bronchial tube, not the bronchiole, the bronchial tube gets inflamed, that will cause congestion, and that will make it harder and harder for the oxygen to pass in the lung. What is the difference between acute and chronic bronchitis? Acute bronchitis is a shorter illness which lasts a few days or weeks, and it commonly follows a cold or a viral infection such as the flu. That's why I like to think of as acute bronchitis as a post-infectious bronchitis. It's always following a viral infection. Commonly follows. Chronic bronchitis, however, is a mucopurulent cough, mucus productive cough, which is on at least 3 months out of 2 consecutive years. What may be the complications? Well, actually, the complication is directly linked to the cause. Now, I wouldn't say an underlying lung disease would be the cause of acute bronchitis. However, this is true that an underlying lung disease like COPD or asthma is going to predispose, it's going to be a risk factor, it's going to be a causative factor to develop acute bronchitis. So, a complication would be an acute exacerbation of the underlying lung disease, which they already have. So, an acute exacerbation of their COPD or an acute exacerbation of their asthma, and that would be the number one cause of hospital admissions. And treatment-wise, I always like to remember all of the treatments that we're going to give in COPD and all of these things, or any infectious agent as ABCO, which would be antibiotics, bronchodilators, corticosteroids, and oxygen. It's always one of these 4 treatments that you're going to give for the lungs. So here we're going to give antibiotics because what is acute bronchitis? Once again, it's a post-infectious inflammation of the bronchi leading to obstruction in air. So you also want to treat the underlying lung disease by giving, by however you're going to treat it. And if you have influenza virus, which has caused it, that you suspect, you want to give a neuraminidase inhibitor.